somebody is positive for HIV, I mean, the preventive treatment is 90 days, but if you're positive, how long is the treatment for?
Well, from my understanding with talking with Dr. Trowbridge was that if the individual, before you prescribe and start working, they take PrEP, they have to take the HIV test. Right. And if it's positive, they wouldn't recommend PrEP at that point.
Right. But there are other treatments for HIV. I'm curious if you knew any. I just don't know the details and the length of that treatment.
I don't, and I know it's changed so much over the years. I was watching a documentary actually this week where a patient was discussing when they first diagnosed with HIV in the mid-90s, they were taking 5 pills a day, 5 times a day. Yeah. And just a few months ago, there was a new treatment that was approved, kind of like the first level of approval. And I think they're still waiting for maybe some FDA approvals, but it's like it was either a monthly injection or a 6-month injection. That was your treatment. So we're definitely seeing that treatment really improve and just be significantly more convenient for patients. Again, like we talked about earlier with a patient going from their PCP and then having to go tell their story again to somebody else, you're probably seeing a drop off in care there. If somebody's got to take 25 pills every day, the challenges that come with that versus getting a shot once a month or once every 6 months, you're seeing an improvement in quality of life and obviously much higher chance of the survival of the patient as well.
Yeah. Hey, this is maybe a broader system question. In Northern Michigan, there's 4 healthcare systems in our region, starting with Ascension in a couple of the southeast counties, and then you got My Michigan, kind of in the center in the northeast, and then you got McLaren in the northwest, and in Sheboygan, then you got Munson. Like, how do you guys interface with those systems? They have infectious disease physicians, at least in a couple of the systems. But what's your experience? Do the rural healthcare providers come to you guys, or do they go to their system infectious disease folks? I know Thomas Judd is a great resource as a clinic, but what do you kind of see as a lay of the land?
We've had a lot of meetings with Thomas Judd Center so far, and we're really closely with them and Munson as well. Some of the other ones we're still trying to get into and kind of give them some information on what we plan on doing. We work pretty closely with Alcona Health Center and that organization. They do a lot of work with our Hep C treatment that we provide. So we definitely are, we'll utilize that to kind of introduce this and make them aware of kind of what our plans are and what we're working on. But yeah, each one of those locations have infectious disease doctors. We also met with quite a few health departments to kind of get their ideas on what they felt. And, really overwhelmingly, everybody, the consistent message was, hey, we want to get the PCPs up to speed on PrEP and how to ask the right questions for screening, because the infectious disease doctors are just overwhelmed. They have a wait list that's months long. And if, just like substance use disorder treatment, if you're waiting months and months for treatment, your chances of survival goes down significantly.